those that are included, and figure out how we can actually implement that, particularly across the Catalyst network, which is quite the unique kind of value of this group. But just to start, I'm Alicia London. I'm the CEO and founder of United for Global Mental Health. So we focus on catalyzing much greater action on global mental health, political, financial, business commitments. So really pleased to be here. Helen, do you want to introduce yourself?
Great, thank you. I'm Helen Mason. I'm the Director of Operations at Child Helpline International, and we're the global network of child helplines that exist around the world in 142 countries to respond to children and young people when they need anything in times of crisis or for information or for signposting.
Great, and we have such a small group here. We just lost Glenn, so we just have us two. Glenn, are you coming back? Because I wonder if you'll join us shortly, but thank you for jumping on. So just to introduce ourselves, I'm Alicia London, and I'm the founder and CEO of United for Global Mental Health. And Helen, do you want to introduce yourself?
Great, thank you. I'm Helen Mason. I'm the Director of Operations at Child Helpline International, which is the global network of child helplines.
Great, and we've got our teams from Catalyst here. Do you guys want to introduce yourself quickly?
Hello, my name is Julius Wijnand, and I'm assessing this campaign as of Catalyst 2030.
Hi, I'm Lillian. I'm a volunteer just taking minutes during this roundtable.
Great. And then in terms of this call, we've had one workshop. This is the second workshop. And what we're looking to do is to come up with some recommendations within the Catalyst 2030 report, high-level report around action that's needed on mental health. The purpose of today, itchy nose. The purpose of today is to go through them. We've been encouraged to come up with 2 shovel-ready solutions that if people got behind them, they could have major impact. We've identified those through the last roundtable. So the purpose of today isn't to come up with new recommendations. It's to interrogate what we have put down, which we can go through shortly, as well as see how can we actually put them into place. So a really practical action plan. This session is being recorded as well for those who aren't able to meet it, just so everyone's aware. And also, actually, just to say, if you've joined now, Elaine saying your camera is malfunctioning. I'm so sorry. One of the hardest challenges of this working from home. But if everyone could actually just change your name, as Helen and I have, just to put your organization. So you can do it by just pressing on the 3 dots at the top and rename. So we can see where you're each coming from. But just as we're such a small group, it might be nice if you introduce yourselves as well. So Elaine, do you just want to come off mute and where you're from?
Hello, can you hear me?
Yes, we can hear you.
Oh, fantastic, thank you. Yes, well, my name is Elaine Flores, and I am a member of the Center for Global Mental Health, based at London School of ID and Tropical Medicine.
Great, welcome. Good friends. We love the work you do. And Joy, did you want to introduce yourself?
Hi everyone, my name is Joy Moher. I'm a co-coordinator of Quality Rights Kenya in the Ministry of Health.
Great, and it's great to see you again. Actually, I have to say one of the last international trips I did was in Kenya, as you know, where we had global mental health advocates from around the world come together and work on global advocacy and campaigning for the years ahead. So I'm so grateful we had that time together going into this. It's actually formed really strong bonds with so many by having that face-to-face time, even more invaluable than we originally expected. So it's great to have you both here and the group, and may have others join us. So as we go into this, Helen, can I hand over to you just on the work done so far and the outcome of this session?
Yeah, great. Thanks, Alicia, and great to meet everybody. So yeah, I guess for me it's helpful just to recap on what we have done so far. And I know last time we met some weeks ago, well, we had a really good discussion about positioning mental health as an issue globally in every setting, but also from my perspective, also bringing children and young people into the discussion as well. And I know that in that meeting we had quite a diverse range of stakeholders from a number of countries. So we had a really interesting discussion and some interesting breakouts as well, which I think enabled us to really, acknowledge that there's been a huge increase in focus on mental health throughout the COVID-19 pandemic. Certainly from the perspective of child helplines, that our members around the world in 142 countries are reporting a big increase in contacts around mental health. In some cases, 1 in 4 contacts is around mental health. So we're definitely interested to look at what we can do in terms of advocacy around mental health. And I think that that is something that came through in the discussion as one of the key opportunities. So engaging different stakeholders to look at the service provision, the financial provision for services, and to look at how we can further coalesce with the different stakeholders that are working in mental health. So it was a really good opportunity to discuss, our various roles and how, the stigma of mental health was affecting the way it's addressed in society, and then how the pandemic had really kind of brought up some of these issues a bit to the fore, in the sense that that was in some ways an opportunity to put some more focus. So I would say that as a result of that discussion and some really interesting ideas around Global Mental Health Day, we came up with some very concrete ideas around solutions that are scalable. So looking at the existing recommendations of the United Nations Policy Brief, which is about supporting the digital transition of mental health service provision. So there's an existing brief which we can use. We can use that as a sort of jumping off point for some of the advocacy work we want to do under Catalyst and as part of the report that we're working on. And then secondly, focusing on the sort of political and the media attention that is really deserved of the mental health issues that affect every level of society and everywhere in the world. So looking at public support for world mental health, but also government support and other stakeholders. So coming together around Mental Health Day, which is 10th of October 2020, to raise public awareness around mental health, to reaffirm commitments on that day. And I think that that is obviously something that is just around the corner, really, October, but it definitely gives us time to have a good run up to put together some really interesting campaigning and advocacy materials. And then I think thirdly, again, the outcome of the last meeting is really looking at the evidence base on mental health to support advocacy. In general, we were able to ascertain through the various stakeholders in the last roundtable that there is an absence or a lack of quality data on mental health. And certainly from my organisation perspective, the data we collect from the child helplines is for some time already indicating that there's a big increase in contacts to child helplines around mental health, and that child helplines themselves need to be better at responding to these kind of cases and having more robust referral pathways. So yeah, interesting from our perspective that we do have some data from our child helpline members, but and maybe Alicia, you have a bit more insight into this, but we're certainly not plugged into the kind of global overview of the data. And I know that Alicia, you had some great examples of the Mental Health Atlas, which would be a platform for some of that data and some of the resources that are available. So this initiative can also focus on how the data can be, amalgamated and aligned and a little bit more effective in terms of its use. So I'd say that's a good kind of overview of where we are so far in terms of like what we did last time and where we've gone from there. Now we have a draft 2-pager, I would say, that's going to be part of the overall Catalyst report. And I'm pleased to be able to say that Alicia's team has done a really great job on that draft so far. And I think that it's a document that certainly my organisation can get behind.
Thank you so much, Helen. That's a really good overview. I wonder actually if what we could do now, we lost a little bit of time to get started, is actually I can just show you the document as it stands. I can share my screen, and particularly for Joy to see what it is. And then I think if we just open to a general discussion around how we can strengthen this in the first instance, and then into, okay, what are the things we can actually do as organizations to put them into place? So any recommendations around that? We've got 4 kind of short to long term recommendations, but shall I share my screen?
Great.
This is always very scary to make sure I share the right screen. Who knows what you're about to see? It's so hard to see. Which one would you like to see? My inbox? My calendar? Okay. Has that worked? Great. Okay. So in terms of so what we've got here, just to talk through it, we have the challenge. And so as Helen overviewed, now more than ever, we need to be investing more in mental health. And so here at the beginning, we all have a right to good mental health. This is the context. And people around the world are speaking out at the moment more than we've seen before. But when they do that, they need someone to turn to. So there's a call to leaders. Services must be protected and scaled. And that, as Helen said, the UN has actually released recommendations. And so what we didn't want to do within this group was come up with a range of new recommendations. What we wanted to say is, well, how can we be helpful based on the work that's already been happening to put them into place? So in Catalyst's recommendations, shovel-ready solutions, Helen says scale the recommendations, especially those that are supporting digital transformation, as something that the helplines and others are working on. We've seen an increase and not the increase of support for them. Especially with lockdowns and social distancing, have another complex layer and the need for that online. So in here in face particular demand for support for telephone and online helplines, Child Helpline International and others are setting up those new, and it really brings attention to that, as well as local organisations. One we thought were worth mentioning, Mentally Aware Nigeria, and others like them at country level. The second is around giving mental health the political and media attention. This is actually something that I think there'll be some organizations that really want to dive into scaling digital and really well set up for that. But actually the second one is something that every single organization, individual around the world could engage in. We wanted something that was broad here, and support on World Mental Health Day. So this year, October 10th, there is an ongoing move from across the community to have a more united day on World Mental Health Day this year than ever before. It's actually been quite a fragmented day where people would, as someone said to me yesterday, come and like fight for their attention for their issue. But imagine if, like Earth Day, everyone came with a united message, a united action to cut through to those outside our communities, rather than fighting for attention. What if we came together and jointly called for more action, particularly politically and through media? So, you know, we've attempted that in the past, but I think this year, given the universal appeal of people wanting action on mental health and actually an increased effort by the World Federation and WHO to really call for that united action, we have an opportunity to come together. We need stronger media channels, platforms, social media, radio networks, outdoor advertising, and the challenge is a common message calling on leaders to act. The official campaign will be launched soon by the WHO and the World Federation, and it will be around this theme of calling for greater political and financial action, which is a really good opportunity for us. And then thirdly, that evidence and getting much better evidence over time. There's been a couple of the data that we're getting through from the lines that are out there, as Helen said, but you know, improving the global data that we have. There's a call for the Countdown 2030, a comprehensive data set. It's currently not funded, so it needs funding, as well as digital technology that can help do that in a faster way. So can we I might just stop here now and open Joy. Actually, it's going to switch back to see, just to see how do those recommendations sound? Do they, for a community like Catalyst and high level kind of recommendations in a report, do they sound like good shovel-ready solutions? Have we missed anything significant? Any tweaks or recommendations to each of them?
Actually, I believe they're really good recommendations, and better off they're achievable up to like they can penetrate up to the community level. Like it's something someone can read, and it doesn't take rocket science to know how to go about it. Like it's simple, understandable, and it's broken down what needs to be done. So I like them. And the good thing is that I'm sure there are different people doing different things. So it's kind of just reinforcing. It will kind of come to reinforce what people are doing and kind of bring more attention to it. And that way we'll be able to see because I believe there's so many other people doing very great things, but just because mental health may not get that attention at the moment, you may not be able to get to know about them. But and I guess it's in line with what most of the world is going to. I like that, put it in line with what the UN Secretary General mentioned in his speech recently. So honestly, I agree with it. I love it.
Great.
Really.
That's really helpful. Thank you. And I think you're right. We really tried to have, like, from the global to the local, something everyone can do, because it has to involve everybody, and the network is broad, especially the Catalyst network. So, and we're so pleased that you like them. Any other comments? Helen, do you have anything else to add? We don't have to take up the full time either. If we have consensus, it's great.
Yeah, I'm really excited actually, because if I'm completely honest, when I first came into this, and also in terms of Catalyst itself, I wasn't completely like I didn't really have a clear vision of how we were going to interact with this as an organization and as a membership network. But actually this has proven to be a really exciting opportunity for us. And I think that, the fact that mental health is just such a big issue for our child helplines, this is really a great opportunity for us to work across, like, the children and young people, the youth demands that we have, and how that kind of meshes with the other services provision that's available globally, and sort of bringing that youth voice into the discussion, which, from our perspective, we haven't really taken that step yet. And I know that our members at national level often do talk a lot about mental health, but as a network perspective, we've not focused on it, and it's only recently it's become a thematic issue for us. So this is like perfect timing.
Good.
And what I think is really interesting as well is that the recommendations we've come up with are really practical, and I think they're really doable, and that's always really good if something's really implementable.
Yeah.
And I that gives me a real sense that we can do something here.
Great. So helpful. And the first roundtable was really helpful in identifying what are those practical things we can do now. Excellent. Well, I might move anything from the Catalyst team. I might move into the next steps in terms of practical actions that we can recommend we do as well to move. But anything from Julius, Lillian?
No, thank you. No.
Cool. All right. And now we have, sorry, go ahead.
Just a quick question actually for Julius and Lillian. So it would be great to just understand the next steps in terms of the report.
Yeah,
just
great.
My understanding, what's the timeline? Is that going to be launched only in English? Are there other aspects of that I can be aware of that might help me to disseminate this through our network?
Yes, so the timeline is for the end of July, and this report will be presented to the high-level political forum indeed. Great.
The one thing that I just might note is, if that's the case, go out then, if possible, I would recommend we include the actual theme for World Mental Health Day and the thing we're asking everybody to do, because that's not yet public and it's not yet actually agreed. So working on it. I can share a little, but once that official theme and the official action is agreed, I think it would be good to include here, noting that this won't be released until after it's released anyway, because I think that will help to drive immediate practical engagement on that day. Got a good thumbs up from Helen. So that's one thing that I can take away from this call to integrate and check in with the WHO and the World Federation on as well.
Just to add something, on the same, because partly, or basically most of this, in order to get all this going, we still need funding, and we still need to incorporate funding in the government level, like because for example, in Kenya, they just bundle it as health, and then by the time it's broken down to mental health, it's very close to nothing. So I don't know how to put it, but like concrete action point that would make it that in as much as like the political attention and the media attention and all these things that need to be done, that the baseline is the funding to be incorporated in all these various levels. So I don't know how.
That makes sense. And actually, the one thing that's not in here, because it's not yet public and I'm waiting for the official language and the official theme and that, but what is being called for is investment on that day. So the entire theme around that day is for calling for greater investment. So that, and that's, again, it's how that's being done is still being worked out. But the good news is you're absolutely right. Mental health has been stagnant for so long, and we have to move that forward. And instead of just generally, let's talk about mental health on the day, instead on that day, let's all come together and all call for greater investment. So I think working out what that looks like, is it access, is it investment, how does that work, what's the action, is the thing that we don't have yet. But just to reassure you, I couldn't agree more. It's where many services and all of these recommendations are struggling to be implemented anyway. And that's one of it's not funding and investment isn't always the barrier, but in mental health, it certainly is a big one. So yeah, couldn't agree with you more. So let's make sure we can get that recommendation into this report to make that abundantly clear. So it's not a day where we'll just generally be talking about mental health. It's a day where across the board, from community level to national to global, there's greater calls for investment everywhere. Cool. I'm excited about that. Thank you, Joy. We feel the pain of so many organizations who are really stepping into the gap and need that right now. They needed it before, but they really need it now. So this is our opportunity to come together with that united message, because I'm pretty sure it's something that everybody needs, and it does unite us. Cool. In terms of actions, we've got those couple of ones to integrate into here. We've got 4 recommended practical action plans. Helen, do you want to run through these?
Yeah, great, thank you. You can see them on the screen here as well. So I'll just take you through those. And again, these are really practical and doable, I would say. This is immediate action is around the recommendations. So what different stakeholders can do. And I think that we plan for some very clear messaging around that. And it'd be great to understand a bit, Alicia, how that would work. Is that something that you as an organization is putting together, or will there be some social media packages available?
It's a really good question. So we've already done some support for that. So I think if this is a general recommendation, we would hope that everybody would use what's already out there and amplify it in the work that they're doing, rather than it all come from one organization. But what I would do is maybe we can be clear about where that policy brief is. There's also a video that promotes the adoption of it. Right. And so maybe we could just kind of package that together and make that clear. The other thing that we have is, for those that don't know, the Blueprint Group is a global group. It's got now 700 or so individuals, researchers, member states, UN agencies, funders together who are committed to global advocacy on mental health. That's the Blueprint Group, you can see there, and there's been a webinar series. We help to facilitate that group, but it's really run by members, and anyone's welcome to join. So that group has been running a weekly webinar series on the latest information to advance these. So I think that's just one example. We can share the core resources, refer to the Blueprint Group, but I think that the immediate action is that across the board, we start integrating that, and those recommendations are integrated into all the advocacy everyone's doing.
Yeah, I agree with you. And that's something certainly that, you know, we haven't done yet from our organisation. I think it's something we can, as you say, like, it's something that we can get behind.
Right.
Okay, and then moving on to number 2.
Sorry, I'll put a link through to that briefing and those resources there as well into this. I won't do it now, but I will do it after.
And then I think number 2 is again about what I spoke about earlier, is like looking at the different actors and different networks that already exist and coming together as one voice as far as possible for World Mental Health Day. So October the 10th is a massive opportunity, you know, given what we talked about earlier about the enhanced focus on mental health as a result of COVID-19, that World Mental Health Day, you know, given this year is going to have a different kind of slant on it than previous years, and I think the opportunity is to maybe widen the outreach to different networks as well. And then moving on to number 3, in terms of long-term actions, it exactly goes to what Joy was talking about, recommending a coordinated resource mobilization effort to secure the resources that are needed, you know, in terms of service provision, in terms of research, in terms of the digital transition of mental health service. So there's been widely reported, you know, that different, for example, helplines are transitioning to remote working, being able to use machine learning and AI, for example, you know, to work on online communication to sort of spot the different ways that people communicate about mental health. There's so much that can be done and so much that is being done already, and it's about kind of, you know, recommending that there's the right investment in the right places. Certainly from our perspective, it's about making sure that child helplines are well capacitated to handle queries on mental health, and they have the right referral mechanisms to be able to refer children on to, like, you know, other services provided by governments and others.
Yeah, I think that's great. And I wonder, for those organisers interested in learning, I think providing a really practical guide here. So your first point, I'll put a reference through to where those resources are found. I think I'll put a link through to the World Federation page of, you'll be able to find resources here to get involved, and we'll update it. And kind of put in like more kind of add in detail around campaign when we have it, before this is published. On this one, I do think the best way to do this, organizations interested in learning about this work and driving it are encouraged to join the Blueprint group here. Yeah. So that gives a way that people can learn more and get involved if they want, and we can put a link through to where you can register for the Blueprint group.
That's great.
And then for the smarter use of impact, sorry, I'll let you go ahead. I've got an idea for this one as well.
Yeah, well, that's great. I just want to say, I think it's really good to capitalize on existing platforms, and as you say, raising awareness about the Blueprint group and the kind of the breadth of that group, and encouraging other people to take part. I think that makes a lot of sense. Yeah, I can mention briefly the transversal action. From our perspective, again, you know, we're currently in development a 2 to 3 year project to develop a global platform, which is essentially going to be available for child helplines to use in a sort of portfolio approach to collect data, but also to manage their services, and also to deploy new services through social media, etc. And that is something that, you know, for us has taken a lot of investment, and it still is. And we're very careful to make this a sort of co-creative process. But what we also want to do is make this resource available to beyond the child helpline movement, so that it's applicable for all organisations that are managing and running helplines. So we see that a lot of benefits in working with different movements, different organisations, different service providers in this kind of open source co-creative way, and that will help with the data collection as well. So over to you, Alicia, on that one.
On this one, I think if we provide a reference to say, you know, if you're interested in that, talk to Child Helpline, or those are in development. The other one that I'd like to recommend, if people are comfortable with it, is the World Economic Forum Global Futures Councils put together the ethical and practical guidelines around using technology for scaling mental health support. And it was the first paper of its kind that really thought about, how do you regulate the Wild West of apps that are trying to do this but aren't doing it effectively, and how do you, what are the things that governments need to be thinking about regulating, and what are the things that those that are implementing solutions should be thinking about to make sure they're having impact. And so I do think, I'm biased because I was involved in that council, but I think the World Economic Forum, as well as World Economic Forum report on ethical and practical guidance for using technology to scale care, I think it's the most comprehensive global look at the key considerations, if people are comfortable using that as a guide for people too.
I'd love to have a look at that.
Okay. To scale care. It's called, and I'll put a link in it here, it's called Empowering 8 Billion Lives or something.
Okay.
That it's got a Futures Council of Ethicists, mental health advocates, technology, and it is quite practical as well. And it's always good to refer to those things that have been developed for this purpose rather than recreating. I have to say, I'm very proud of this group to focus on stuff that already exists and advancing it rather than let's come up with a new thing. So cool. And I think that's it. Cool. I think that's everything. So I'll stop sharing that now so we can see each other. Oh, hi, we've got Dorothea as well joining us. Do you want to just introduce yourself briefly?
Yeah, hi everyone. Just a second and I put the camera on as well with at least a nice background because I have something. All right. If you see me, hi.
There you are.
Hi everyone.
Hi.
I joined a little later, but I didn't want to interrupt in the discussion that much. You were really into. I'm Dorothea. I'm from the Netherlands, well, based in the Netherlands, having my consultancy, Unique Skills Consultancy, focusing especially on social skill development and also mental health through mindfulness for kids and youth. And I'm really happy to be here already the third time, but didn't have the chance to introduce myself yet.
No problem.
But here it is. I just wanted to ask one little thing to this report, that at the first meeting, we were discussing more about the civic society inclusion. So I was wondering, because I didn't really get that you included in the report, how to include more the civil society in the word Mental Health Day. Can you share your idea about it, or maybe I just missed it? Sorry.
I think we may have missed this one. So here we go. If I go back to sharing.
Thanks.
So Ronick, 1 second, where is it? I think this is it. Yeah, so here. So that was really the second point. The first point was around scaling care, especially during using technology, for those that are doing that. The second was everybody, especially, maybe we haven't been clear that, this is civil society, kind of everyone, like a united civil action on World Mental Health Day. So this is about the display of unity from policy, civil society, business, celebrity, all coming together as one. So it was really doing that, recognizing that there actually hasn't been a very strong united approach to World Mental Health Day from civil society, with many often being fragmented. And so how could we develop that on that day? And we discussed, and I do think there'll be new champions coming in this year that we haven't heard talk about this before, given the year that many are more thinking about this. And so the more united we can be, the more impact we can have. And so, yeah, I think that's it. The main theme around that day will be around calling for greater action, investment, access, that kind of thing. We're waiting on the official theme for the day from the World Federation and WHO. So essentially a civil society movement getting behind that would be the proposal for the day. Okay, that's great. And how, this sounds amazing. It's just
What I'm not sure, or maybe it's going to be, of course, the next steps, because this is just a draft report. But like within the campaign, are you thinking about like start a movement just like a Global Money Week, or something else to include more also, not just the organizations, but everyone around the world?
Well, it's definitely the aim for the existing World Mental Health Day campaign. It's the 10th of October that week.
Yeah.
I think it's just doing that in a more strategic and united way rather than creating something new. It's about how do we leverage that opportunity together better.
Yeah. Okay.
Yeah.
All right.
We already have the organizations kind of set up to drive that, so let's get behind them.
Yeah, I totally agree on that. Yeah. It's maybe, I don't know the Blueprint group, as I already made a note to check it out. So.
Okay, and we'll put links to this document there.
Yeah. Okay. Will you share this document in the chat here, or I didn't get an email about this, so that's why I'm just.
Yep. So we will share it after this. We'll just make a few edits on the call, and then we'll circulate and follow Catalyst with how we'll do that.
Okay. Perfect. Great.
Great.
Thank you for sharing.
I think it was supposed to be 2 pages. So our question for the Catalyst team, is it okay if it's 3?
Well, rather 2 pages, to be honest, but I think, yeah.
I mean, we can make the challenge shorter. We can cut it down if you really need us to. Do you need us to do that?
Preferably, yes.
Okay, we'll have a go.
Okay, thank you.
Also, there is someone who's going to be kind of editing the whole thing, so maybe they need to make those decisions, because I'm guessing other groups might have longer 2 pages as well. So I don't know, maybe it's worth just submitting what we have.
Yeah, okay, that's also fine indeed. Yeah.
Okay, great. Perfect.
Yeah.
All right. And I think that's it. So because we have that draft, we've got those inputs. I think it's a really good idea, Helen, to just have those practical, how do we actually do each of those incorporated into the actions is really good. And I guess that's it. Are there any other comments? And we might then hand over to Catalyst on any other next steps we need, but anything else we've missed? And we're very efficient in this group.
Yeah, if nobody has any comments, yeah, thank you very much. It was started out a bit different, but yeah, it was very interesting. So I think, like you said, very efficient. So everybody will receive a mail with all the follow-up information and the circulation of the documents, etc., etc. So, thank you very much, everyone.
Okay.
Wonderful, thank you. I enjoyed that.
Yeah, me too. Thanks, Helen.
Thank you.
Thank
Have
you.
a nice week.
Thank you.
Bye.
You too.
Enjoy
Bye.
the story. Yeah. Bye.